Rob and PROJILITY asked me to share some of Froedtert's, how we've implemented Microsoft Project and some of our experiences. So first I'm going to tell you a little bit about Froedtert Health and me, and then I'll walk you through some of the lessons that we've learned along the way. Next slide. So this is me. I have been a project manager for 24 years. I've been in healthcare for 27 years, both on the payer and the provider side. I'm PMP certified, and I've actually have a master's degree in project management. I do have to admit that the master's degree was an effort to try to keep my continuing ed credits so I wouldn't have to take the PMP exam again. I've worked for Froedtert for 9 years, and I'm a senior systems analyst, as Rob said. I support Microsoft Project and some other business software. In my role, I maintain the operations of Microsoft Project Server. I support users, and I also design and implement project reports. Also part of my role is to advise the PMO, the Project Management Office, leadership on how project can be integrated into their processes and how data can help them make more informed decisions. Next slide. So a little bit about Froedtert Health. We're an academic medical center in eastern Wisconsin. We have 6 hospitals, 4 community hospitals, and 37 clinics. The community hospitals are just smaller hospitals. There's 17,000 staff and employed physicians who work for Froedtert. And last year, we had 1.7 million outpatient visits. So that's just to give you an idea of our size. Next slide. So this webinar is focused on healthcare, and you might wonder why we're talking about healthcare specifically, why I got brought in, why that makes a difference. It's because healthcare does it all. The type and the size of projects vary greatly. Projects include, medical services, but also buildings and kitchens and purchasing, all different types, as well as all different sizes. You could have something as small as converting a few exam rooms or as big as a medical complex. So projects done by almost any other industry are also done by healthcare organizations just because of the wide range. Next slide. Another big difference about most of the areas of healthcare is the financial health. So as we face higher prices and shortages of staff, many businesses have to raise their prices or limit their hours. Most healthcare organizations just can't do that. We can't limit the hours in our hospital, and Medicaid and Medicare reimbursements have not increased, although all medical supplies and staffing costs have risen dramatically. We are still getting reimbursed from other areas besides Medicaid and Medicare, but that's what is growing part of our population. So with the variety of projects plus the financial health, healthcare needs to work smarter with more information to handle this. Next slide. A little bit about Froedtert and Microsoft Project Server. So Project Server 2010 was implemented at Froedtert in 2013, and in 2020 we upgraded to Project Server 2019. We have 22 IT project managers supporting about 120 projects a year. For key initiatives, which are our major projects, we have a budget of about 208,000 work hours per year. That's covering 500 IT staff that are tracking their time there. You might wonder why we upgraded to version 2019 when Project Online was available. At the time the decisions were being made, Froedtert leadership decided, or that was hesitant, to actually go into the cloud. Healthcare being very careful about the security of data. We now know that that environment changed very quickly, and a lot of applications are now part of the web as a normal operation. Next slide. I'm going to walk you through our sort of road trip with Project. As I mentioned, Project Server 2010 was implemented in 2013. That was actually 2 weeks before I started with Froedtert, so I wasn't involved in the installation and the decisions at that point. From what I've been told, Froedtert IT was using a different scheduling software, and they were using that software to also track time. The time tracking and the project detail got to be so minute that many people just stopped tracking their time, which meant that the data in the system really wasn't useful for anything. As a result of the decision, they decided to throw out all of the software and start from scratch. They probably didn't need to throw it all out, but I'm sort of glad they did. Leadership at the time wanted to install Project Server in less than 3 months. They only wanted to be able to do simple time tracking and then give the project managers a tool to track their projects. Note that implementing project in less than 3 months is not a good idea. It's just not enough time. What they ended up with was 1 line per project to track time on. That was the goal of keeping it simple. Project managers got limited training. The reporting and processes were not implemented, and there were no discussions with Froedtert organizational leaders. As a result, in the system that was easier for resources to track time, again, that was the goal, easy for project managers to add resources, but no ability to plan and resource demands. Next slide. This brings us to our first lesson. Process is as important, if not more important, than software. Froedtert didn't need to change the software to get different results, as I said. We needed a way to plan resource needs, select projects by analyzing resource availability, and also consistent project management so that everyone is working off the same playbook. At this point, I'd just like to note that when I'm saying we, I'm referring to Froedtert as an organization and the IT project management office. Next slide. I'm not sure if you've heard of peanut buttering, but that's what we had because of a result of having 1 task line per project schedule. All the resources were entered on the project schedule from the start to the finish of the project. So say even if a network resource was only needed for 2 weeks on a year-long project, their time was spread across the whole entire year. So we couldn't tell if resources would actually be available or if projects would conflict needing the same resources. We had 1 big bucket of information that provided very little value. So we implemented deliverable-based project schedules. And that's somewhere between no detail and too much detail. That led us to our next lesson. Find the sweet spot. Ease of time tracking for resources with enough detail to provide leadership and PMs with relevant information. If you do that, it results in effective project and resource management. This is the lesson we learned from going from single lines to deliverable-based resource planning. It was a big change for Froedtert IT, but we moved us so far ahead by doing that, it allowed us to plan more effectively. Next slide. We started talking process. All the project managers were trained in building deliverable-based project schedules. All the IT resources were trained to track their time in PWA, Project Web App, and also why. Why is really important because people are more effective if they understand why. They want to know why they're being asked to do something, and also, well, how is their efforts going to be used? We trained IT leaders in new PWA reports, which gave them the ability to monitor their team's work and plan for future projects. Resources were invited to work breakdown structure meetings at the start of a project. In those meetings, resources determined what deliverables were needed for each project and how many hours it would take. They're the experts. Every team was invited. Every team was invited with no surprises. The reason I say no surprises is too often teams are included until someone remembers, maybe even 2 weeks before a go live, that another team is needed. Bringing resource in at that point is a challenge. They may not have anyone available to help. So when you bring everyone in at the work breakdown structure meeting at planning, no surprises. Next slide. This is where lesson 3 comes in. Make sure everyone is trained, including the why. Keep training, then keep monitoring, and then repeat. I can't tell you how many times we need to be reminded of repeating. You can't just train once and expect perfect results. Next slide. To make decisions, you need information. So we asked our IT and operational leaders what they needed. Every IT project was then scoped and estimated. Operational leaders were provided with a budget of IT resource hours, sort of a checkbook. They set the priorities according to Froedtert's annual plan tactics and other measurements, and then they ranked all the project requests. With that list, they took the resource budget and were able to tell which projects were sort of above the line and which would have to wait. This wasn't based on who was the most powerful in the room, but it was based on information, which is a lot easier to use. And that's the key from getting out of Microsoft Project. Next slide. Lesson 4, operational leaders need to feel ownership. Before this, we were hearing that IT makes the decisions and controls what the organization is going to do. We didn't want IT in that position. We wanted the operational leaders to make that decision. So that's the difference that made when we implemented this process of prioritization. Next slide. Our process improvement continued. We developed project schedule templates and standardized our IT PMO processes. One of the biggest questions asked was, what standard can we develop that will work across all types of projects? Remember, we talked about why healthcare is unique, because we have to do everything. Next slide. We learned that we have to allow for flexibility to a point. We decided which information was most important across all types of projects. Then we planned for consistency. We were also flexible to track valuable information that was important to specific project types. Next slide. Here's a quick story. In 2017, organization realized that the makeup of our hospital rooms was not in sync with the types of rooms currently needed. For example, there's a difference between equipment in a room for a cardiac patient than there is for a surgery patient. The CIO, the Chief Information Officer, along with Froedtert's organizational leadership, decided to halt all projects and concentrate on the reorganization of one of our hospitals. Leaders asked the PMO leadership these 3 questions. Which projects would have to be stopped? Which projects were close to being completed? And how many resources would we need to take to complete the new work? Unfortunately, PMO leadership couldn't answer these questions because projects were not being monitored for consistency. The leadership, along with the project managers, worked for a week to try to straighten everything out so that they could get information and give informed answers. So we reorganized the monitoring of the projects and the process, ready to pivot at any time. I can tell you that's easier said than done. Next slide. Microsoft Project, when used correctly, will allow you to pivot when business changes. As a result of learning this lesson, in March of 2020, we were ready. We had done the work to track the information, monitor projects for consistency. Leadership came to us again and asked IT to, well, I shouldn't say asked, they told IT to stop all current work, determine which project requests only via a clinical COVID committee, be flexible to implement projects quickly, and enhance reporting to track progress. We all know what happened in March of 2020. Next slide. And finally, we need help. We all do. Questions and issues come up, and everyone needs to know who to go to for help. Some examples for when we needed help are listed, just as examples, like training project managers on Microsoft Project, report writing, project schedules that need help when the schedule sort of goes all wrong. The project manager isn't quite sure what they did and needs to straighten it out. Even understanding the calculator, which is built into my project as a scheduling engine. Some of these rarely happen, but when they do, we needed to get help. I can better show you our support model with the following diagram if you go to the next slide. So this is just a diagram showing you our basically support model. 3 parts of Microsoft Project Server, the PWA Project Web App, which has timesheets, reporting, and general features. That's where we maintain them. Project Professional, which is the project schedules. And then Project Server, which is the enterprise system. So with PWA, the users and the project managers, if they had any questions and issues there, they went to designated people in the PMO that were designated as support. Project Professional, the project managers, if they had issues with their project schedules or questions, they went to senior project managers. If either of those groups couldn't answer the questions that were asked, the question or issue got escalated to me as the business systems analyst. Then you have Project Server and the enterprise system, basically what everything's built off of. And major issues there or general maintenance all went through me as the systems analyst. I would then include our infrastructure teams to help me in whatever needed to happen. Now, our web team is responsible for all things SharePoint, and because Microsoft Project is built on SharePoint, they have been invaluable to me to help me with many things that have happened. Again, rarely, but when it comes in, you need help right away. Next slide. So make sure you have support for Microsoft Project and your users. As we talked about in the beginning, there's so many different aspects of healthcare. It's the same with Microsoft Project. We get help with many different, we get help from many different resources listed, other organizations, other project managers, MPUG, which is Microsoft Project User Group. If you haven't heard of them, they're a great resource. Microsoft, and of course, the internet. We also use a consulting business when we need to, and we've used PROJILITY.